Okay, so the Italian registry. So what happened in Italy? I mean, Marcello already mentioned something, but just to refresh, when we started our journey, it's actually 20 years ago, almost. Next October it will be 20 years, and Billy Di Mauro was in Pisa for, I mean, we were organizing a symposium, and he came, and a lot of the people that are in this room today start thinking, why don't we organize a network? Why don't we organize a registry? And so we start this discussion that grow through different meetings, including the partnership at certain point with the Mitocon that was grown. I think Mitocon is now 19 years, so it was created, who knows, 18 years ago. So basically, at the time the patient association was created, we were thinking about the registry. So we met in Rome, I remember, with Piero Sant'Antonio, Massimo Zeviani, and a few other people. And then we got some money from the Teleton in 2009, and we built the registry, which was online in 2011. And since then, you know, the clinical network that you know was growing. We now have 18 clinical sites spread from the north to the south, even though we are still lacking clinical centers in the eastern southern part of the country mainly. And we have 5 pediatric units, and so also children are very well represented. And as discussed, more recently we were joining as a registry the international effort that was starting in that, I mean, a few years before 2020, but we decided to join the Genomit Consortium as also as a network almost 5 years ago. So what we have now in Italy, we have around 2,000 patients. In Italy, we have the majority, I would say almost 95% of those patients are genetically confirmed. So most of our patients have a genetic definition, and that these are the numbers of the visits that we are collecting through the years. We have more than 2,000, of course, baseline visits, but we are collecting you know, every year the follow-up visit in the registry, and we already have almost 1,000 follow-up visit at 2 years, and so on. We have up to 6-7 years of follow-up in the registry. As I said, we are very well balanced between children and adults clinical centers. However, the majority of the patients we have in our registry are adults, and then basically the same amount of male, female. This is quite homogeneous finding compared to the other countries, so we are not different in terms of general prevalence of the genetic variants. And so the majority of our mitochondrial DNA point mutation are harboring the 3243, and then we have the most common LH mutation followed by others. Regarding the nuclear genes, the most represented in Italy is OPA1, and the second one is POLG, which is quite common, followed by Twinkle. We have very few TK2 cases, for instance, until now. And in the registry, I can't remember if we have any 1555 patient. I have to ask Julia Cecchi, who is in the room. Do you know how many 1555 we have? No, difficult. So, but I guess very, very few. In terms of phenotypes, clinical presentation, here you see that the most represented phenotypes are the CPO and the MILAS, followed by unspecified, meaning multisystem mitochondrial disease that doesn't fit in one of these definition, phenotypic definition. So a lot of CPO and MILAS patients. So basically, this means that we were able in this in these 15 years to build very big national cohort with more than 2,000 patients. We are recruiting more and more longitudinal studies because it's important to have the also monitor the evolution. The granularity, this is definitely improved since we joined the Genomit registry, and we have enough data to characterize individual phenotypes or individual genotypes. So definitely the network was quite active in the past. When I was thinking what to say in this presentation, I think that one of the reasons why we have a national network, and this is especially important for the patients that are here today, through this network, through this registry, we are developing what I think are 4 strategic pillars: genotype, phenotype correlation, natural history, getting ready for trials, and expand our international collaboration. So the first pillar, what we did, I'm not going to go into the papers, but we have produced more than 60 scientific articles. Since our first publication in 2012, we went through multiple studies addressing multiple requests, and I remember this particularly, during the acute phase of the pandemic, we were in touch with the patient organization, tried to monitor the situation almost real time. We were able to publish almost immediately the situation of the Italian mitochondrial community during the first pandemic with COVID-19. Natural history studies we have done, with Vincenzo Montano was coordinating the studies on primary mitochondrial myopathy that were also used, very useful also for the clinical trial development. Natural history of the single deletion, the historical 3243 paper that is going to change now with the Costanza international approach. Trial readiness. Italy, as was mentioned also during the roundtable, was extremely active in recruiting patients. Actually, Italy was so far always the country with the majority, with the highest number of patients enrolled in interventional clinical trials, despite being a small country. We recruit more than US, for instance, in different interventional clinical trials. International collaboration, of course, here, as already mentioned, of course, thanks to our commander, and then, all the French that joined the initiative, we started from this kind of initial Genomit consortium, and then it grew. Now it's much bigger, it's growing, and we are trying also to enroll African countries soon, hopefully, if Marcello will organize fast enough a meeting. And these are examples of what is it possible to achieve with this international collaboration. This was already shown by Holger, but Caterina was leading 2 important international studies on ATP6 and DGK. Costanza is going to start publishing the international cohort of 3243. Newcastle is leading the 8344 international consortium, and Thomas and mainly Luisa are working on this international interesting topic, mitochondrial diabetes. Pier Vito and Zeynep were recently coordinating this twinkle-related disorder study that was published a few days ago. So we can really do a lot. So a lot of, we have 4 pillars. A lot of challenges are still need to be addressed. So Genomit Consortium is a way to go. Another way to go is to deal also with the European reference networks and with the scientific societies, and of course the IMP and patients advocacy groups. Just a few words on the ERNs, because I think is another important way to increase awareness and knowledge on mitochondrial disorders. So we have these European reference networks in Europe that were created in 2017. Regarding mitochondrial diseases are represented in two year ends, the Euro NMD and MetaBird, but in part also in the year end covering other rare neurological diseases and also the rare diseases of the eye. So we have now an intern year-end mitochondrial working group that is trying its best to coordinate activities within Europe, and the example of these projects are the guidelines that we recently published in these years, like the mitochondrial myopathy or the management of seizures in mitochondrial diseases, and the MILAS workshop that Costanza was presenting yesterday. So nothing, of course, could be possible without the Italian network. I'm just bringing the voice, representing the network. I'm sure someone is missing here. I was trying to revise, so somebody will. At each conference, I miss someone and they got upset. But for sure, we are all together the ones that are achieving the results. And our, how do you say in English? La nostra fortuna was that most of us were growing in Dr. Di Mauro's lab in New York at Columbia University. And this legacy probably really created a lot of brothers and sisters under the name of Billy Di Mauro. Then we came back to Italy and we maintain a very close friendship. And let me close my presentation just a word to a very good friend of the mitochondrial Italian community, also a past fellow, Dr. Di Mauro. He was always joining the mitochondrial activities, and unfortunately passed away, Francesco Pallotti. Thank you very much.